you approach everything, internal and external, through the lens of the consumer. So you have internal consumers, you have external consumers. What are some other use cases where you've actually? I'm going to take you back, force you back here. So I think one of the most impressive projects I actually take some credit for. I really shouldn't take any credit. It was really you. Was this 60 back?
Okay.
You remember 60 back?
Remember it well.
So talk about 60 back, because I think every healthcare CIO should initiate a 60 back project tomorrow. So talk a little bit.
So it started really back in the day when we were, how many minutes can we get clinicians back, right, on their day? Because they were like, man, logging on. Sucky experience. So number one, go and spend time out of the ivory tower and make sure you're in there on the shop floor with the customer. Right? You know that we will spend many a night in the ED and seeing where we can improve lives and workflows. So we demonstrated to every one of our clinicians we were able to give them 15 minutes back on their day every day through some of the single sign-on and badge and go technologies, and that was way back. But I apply that to every situation to this day. I go in first and foremost, let me look for a problem first, rather than assume people have got a problem. Speak to people, interview people, spend a lot of time in the offices just looking at this stuff. And that was to say, I think this one, the difference was while we were looking for problems still out in the hospital floor, you set the challenge of, if you did 15, you should be able to double that. And I'm like, maybe. And you're like, why don't we start with 60 back? And then 60 back was full. So the challenge was, how do we get 60 minutes back a day, every day, to the caregivers? And so it spawned from there.
So that's the role of the CIO, by the way. Somebody comes in and gives you a great gift of 15 minutes, and you go, yeah, make that 60. Or they go, yeah, I saved you $1 million on your budget. And you're like, all right, make it 5. I mean, that's sort of what we do.
Constantly reinventing, I guess, right?
But that is such a great project, especially since we've done the EMR projects and we've added to all the clinicians' day, and we're seeing this burnout happen. It would be great to continue to make those efforts. And it wasn't huge. It wasn't a huge project. I remember one of the things you guys came back and said is, hey, what we identified in the ED is when we redid the ED, we didn't put the printers in the right place. So all we did is we bought like 2 additional printers, repositioned them all, and we saved 5 to 10 minutes of these people trying to find things.
Some of your Greenbelt training here is good to have some of the Six Sigma folks coming in and just looking at the digital workflows, right? And so it wasn't simple as that. So we could save a couple of minutes a day here, and it adds up quickly. One of the bigger things, especially medical, is the badge and go printing is very helpful, right? As well as some of the prescription printing. There's some complexities around that. It usually involves a poor end user scrolling through some horrid list and it printed some. I mean, it's a nightmare. So we implemented systems. Whereas the process printer, I just badge it, boom, out comes my job, and I'm ready for it.
Yeah, that was great.